Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, we're back from the break, and but anyway, I hope you enjoy my political comments. You know, we were just talking about the future of the, and Ray, we wanted to thank you for bringing up D-Day, and that was part of the comment that Creig made about this too, was that those brave young men giving their lives so freely for this country, and they're rolling over in their grave, what we see in political today. You know, it's Ray, you on the phone?
Yes, I am, Doc. I see my buddy Ron called in and put down this frankincense and myrrh as some kind of death product. Well, maybe that's a perception, but I just saw a 9-part series that Chuck Augustine gave me about the truth about cancer. Applauds these two substances, essential oils, as healing products that people for thousands of years have been using it. Maybe that could apply to Jesus in the manger and everything else. Maybe that was part of it, not just death and I thought it was a morbid thing that Ron said, but anyway, I want to correct him. So there you go, Ron. Second thing I want to ask Dr. Christensen, when someone has arthritis, especially in the knees, is it beneficial to be walking, or should they avoid that? Does it exacerbate the problem as far as arthritis in the knees? Because some people are reluctant to walk because of the pain.
Well, it's a catch-22 situation, Ray. You have to keep moving. You have to keep moving. As we get older, I'd be willing to say, you know, I have knee problems. You probably have stiff and sore knees. As we get older, those are the two joints that they end up replacing. And thank God we live in a day and age where they can go in and replace those joints, and we don't even skip a beat with the quality of life. It's a fine line you walk. It depends on, you know, if you can move or you got to get out and move. I put a lot of my patients this time of year in the swimming pool. I put a lot of them, you know, at the gym. We're trying to get a program going at the Independent Health Center where we've got trainers that are already working at the gym that we know, that we have a relationship with, that I can send my older patients when I've worked with them to the gym, and they will specialize in trunk stabilization for these patients. They will specialize in aerobic, anaerobic capacity to get your heart and your lungs working better. I believe that the more active you are, the better you feel, you know, throughout the day, the better you sleep, the better you eat.
Well, I believe that me walking every day for the last, I started my 19th year, has helped me tremendously, because at times I'll get up in the morning and the knees don't seem like they're functioning, but after I walk for a half hour or an hour, it feels so much better. And I encourage people to exercise, especially the walking. It used to be you had to walk at a certain speed. You had to do this to get your heart up. I think just a natural walk is beneficial.
Get out and do what you can do.
Absolutely.
Get off the couch, get out of the recliner, you know, make sure you have your ice bags and things for when you get back so that you know, treat it like an athlete. I mean, essentially you're a geriatric athlete going out and you're in some type of training to keep moving. The osteoarthritis that we all get, I don't care who you are, we all get some form of it, is that arthritis that takes us 25 or 30 or 40 minutes in the morning to get moving before we feel better. But you got to move.
That's right.
You got to get up and you got to move.
You guys got a good show tonight. Thank you very much. I want to thank Ron for calling in and giving me the compliments that he did on TV. And I hope to see you guys next week. You know, no replay. Come on, somebody show up.
Yeah,
we'll keep the faith.
Yeah, no,
Thanks, Rick.
Yeah, and if it wasn't for the holiday, you know, the other time, you know, we had a technical difficulty the week before the holidays. We were both here, but other than that, it was an unfortunate chain of events. So sometimes it always pays to watch the shows over again. You get a second higher level of significance from some of the things that I say and on the show, and we were just talking about one thing leads to so many topics, and from degenerative arthritis, you know, let me tell you some of the things that might be useful. The glucosamine chondroitin products, the MSM, they work by tricking the synovial lining to make a more lubricating fluid, okay? This is where hydration is very important too, okay? What happens when you have degenerative arthritis is the joints, these cushions are wearing out over time. The fluid in our joints become less viscous. And that viscous is like going from a 30-weight oil down to a 5-weight oil. And that 30-weight oil gives you that cushion, but as you get older and you have inflammation, that changes the viscosity. It really does. It changes the viscosity of the synovial fluid from a 30-weight to a 5-weight. So now the joints actually wear faster and they become more inflamed. Glucosamine and chondroitin doesn't work for everybody, but if you catch it early in the course of the arthritis, the degenerative arthritis, it tricks the synovial lining to make a more viscous solution. So you should always try that. It is a natural product, okay? And then Tylenol is actually the pain reliever of choice for degenerative arthritis, because and I don't know exactly, nobody really knows how Tylenol works, but it does work well on that type of arthritis. And hydrating yourself is very important. So lubricating those joints and pushing that cushion back in there helps a lot to help that. So one of the things you can do, obviously, is drink those fluids, especially now that it's hot. You drink until your pee turns clear. That's when you know you're hydrated, and then you're ahead of the curve. Once you get behind the hydration curve, you cannot catch up. And that's hard on your kidneys, it's hard on your lungs, hard on your heart. So, and then you get lightheaded, dizzy, and our circulation, we've talked about it before, as your circulation changes over time, that causes issues. So, and makes it more susceptible to what we call orthostatic changes, getting up and falling over because your blood pressure drops up. Marvin on the phone. Marvin.
Yes, Dr. Reiner, a quick question. I was at the VA one day, and I went next door because I saw where they do bone structure, what is it you call it? And I saw your name on the office door, but they were closed up.
Well, that's the Independent Wellness Center. Is that what you're talking about, the chiropractic building next to the...
Yes, a chiropractor. I couldn't think of the name.
Yeah, that's our office. That's Creig and I's office. So I go there frequently to see some of the patients because we have to see them over there, so I'm over there on a limited basis, but I try and get there as much as I can. And Dr. Christensen is there 24/7, really. But it seems like
you do the chiropractor yourself?
Yes.
Okay. Well, I hurt my back on a roof, and I was thinking about getting a laser surgery, but there's none around this area or in Las Vegas, and I didn't know what to do, and I wasn't sure I really wanted somebody twisting my legs and my lower back.
Well, there's other ways to work with that situation, Marvin, without having to pretzel you up and twist your back. There are other techniques that are very effective that we use.
Well, I won't go in for back surgery. That's out. I had a friend that never recovered from it.
it is a gamble. Back surgery is always the last option of last options of last options. Because of scar tissue and other things of that nature that can settle in and actually make the problem worse, and there's no guarantee. But if you become so debilitated where you can't do anything, that's when I would consider back surgery as a potential option, because your downside is no worse than what you're at currently. So, But you know, this is the dilemma that exists with all orthopedic surgery. If they repair your knee too soon, it wears out before they ever do so. There's no guarantee that the surgery outcome is better than what you had before. Hips included, and back are one of those things. So you've seen it, I've seen it, the failed back surgery, and then the insanity of the issue is they go in for more surgery. You know, Einstein. Insanity doing the same thing, different, expecting
I see
different results.
Renee Goodhart, but I don't go in unless I have a problem. So I haven't been in there in probably almost 6 months or more.
Yeah.
But I was thinking about checking with you if I could. I left a message. I forget her name up there in the front. Said she would put it on your desk and have you call me and make me an appointment. Both girls said they did that, but you've never called me, and it's like I said, it's been over 3 or 4 months.
Well, no.
I've only been in there, I've only been over on that other side of the building for a month. I would ask you, Marvin, I'll be there all day tomorrow except between 12 and 2. You come on in and we'll put aside some special time to sit down and educate you and show you what we can do.
Well, I'm not talking about that office is where I had talked to you, talked to the girl in your office. This was down
In my office?
by Terrible's, yeah.
Okay. So the guilty party is my office, which doesn't and can happen occasionally. So, hey, Marvin, if you'll leave your number with my producer, I'll get it and we'll make a special call that we don't have to put it on the screen so that I can give you a call and get you in. Okay?
Yeah, I have an unlisted number. I really don't like giving it out.
Yeah, so if you want to give it to the producer, I'll call you personally. Okay? If that's okay.
I'll think about that one.
Okay. If not...
Thank you for your time.
If not, then I may, if you call back another time, I'll give my producer my cell number and you can call it. So that way I can make sure you get in. So, yeah, I do apologize for that. You know, some people leave messages in my office and we get really busy, and that's a never-ending battle. So I just, you know, I have 4 lines coming in, there's share going out, but I don't want to make excuses. It's a good problem to have, but it's really hard when you hear people can't get in to see you, they can't get to talk to you. So there's only as good or as bad as the people up front. You know, it's a sad thing. I do that. So this is, you know, and thanks, Ray, for reminding everybody it's D-Day. And we've got this, you know, huge, you know, I'm not one for politics, but, you know, we got a really huge political decision coming up. The future of this country is and riding on thin waves on both sides. So anyway, I guess that's really, you know, I don't have much else to say. Do you have anything else to?
No, we will research the essential oils, and we will revisit that topic next week.
Yeah, and then we'll talk about anything else, but remember to stay hydrated in this heat.
Absolutely.
And those people, when the wind's blowing, I know the smoke is out there from the California fires, you know, it's good to stay inside and try and use filters to try and take some of the particulate matter out of the air. The lady who called in earlier with the nosebleeds, please, you know, use a cool mist humidifier to help raise some of the moisture in the surroundings. Make sure you're using distilled water. Make sure you clean it and that you clean your humidifiers. And don't use any forced trauma to the nose. Those things can actually cause more problems than they solve. Like I said, hydrate yourself, glucosamine chondroitin for degenerative arthritis. Give yourself a chance to get up and get moving. Don't get up too quick as you get older because you don't want to fall down in the process. So y'all have a great evening. Thank you for tuning in tonight. Craig, thank you for being here. We'll see you next time. Thank you.